Hello everyone. Today we will be talking about what I learned throughout the past 2 years of residency regarding how to write an HMP, and then we'll talk about like what do you look for in a progress note, and then we're gonna look for what are the kind of important things that I would like to share, and then we'll make other videos about certain topics. So for the HMP, so initially for HMP there is HPI, initially the history of present illness, like what did the patient present with. The way I like to do it by doing paragraphs. So the first thing you want to do, you want to include the patient with the past medical history. You want to include like this is in the past medical history. For example, I would say 60-year-old male with HFrEF, AFib on Eliquis, HTN, HLD, and COPD, period. So that is the first paragraph. That is what I would like to know, like the first thing, that kind of a brief, and try to use these HTN, HLD, like kind of small words to kind of have a pretty good idea of what the patient having, like their background. Because most people that come in the hospital, they have like certain background medical issues like heart failure, hypertension, COPD, and then something that make them feel worse that they need to come in, like pneumonia, for example, heart failure exacerbation. They become volume overloaded, they become volume depleted. Most of the patients have some volume issues or some sort of infection. These kind of the common things. Okay, so this is the first thing that I would like. Okay, now the second thing, the second part I would like the why did they come in here, and like the things that we learned in medical school. For example, like the chief complaint, you can write the onset, severity, aggravating factor, relieving factor, these kind of things. So for example, the patient presented to the hospital with chest pain that started 3 days ago, period. The pain is 10 out of 10 in intensity and worsen with exertion and relieved with rest, period. No previous episodes, period. The patient complained of shortness of breath, nausea, vomiting, and abdominal pain, period. Patient denies fever, leg swelling, and headache, period. So this is kind of the idea, like after you do the past medical history. This is what I usually like. That's be really cool. A lot of people would like it this way. The onset, aggravating, relieving factors. This is kind of the idea of how to write the second thing. The third thing that I would like, this is an example. Okay, you can add other extra, like if they have other certain procedures recently, if they have recent heart cath, you can add it here. Okay, it's kind of what the information you gather from the patients. This one, the third part, is what happened in the ER. Okay, this one, the second thing, the chief complaint, I call it LICORA. Okay, which means location, intensity, quality, onset, LICORA, radiation, aggravating, relieving factors. It's kind of these things. The third part is what happened in the ER, or what labs that available right now, and what did the ER physician give the patient. That's what we try to do. For example, I'll just write an example. In the emergency room, vitals were stable, period. Labs showed leukocytosis and elevated procal, suggesting possible infection, period. Chest x-ray and urinalysis are pending, period. ABG showed respiratory acidosis, period. So this is an example. What I would like in the beginning, I used to write numbers and stuff. You can write numbers, but at least interpret it like metabolic, respiratory acidosis, and think, why did the patient have that? For example, respiratory acidosis, I would say likely due to obesity hypoventilation syndrome. Or you can do it likely due to COPD exacerbation. And these kind of things, that trying to know what are the labs that are present, and put some of thinking, and then you can put in the ER, okay, or you can, like, let's say, okay, and then this is you can see what the ER recommended, okay, you can put it after that. He was also given 1 liter of bolus normal saline and started on Rosefin, period. CT chest ordered and it's pending, period. A blood culture and urine culture ordered as well, period. So this is kind of the things that happened in the emergency room. This is kind of the idea. I usually also like to include the medication that they're taking. Patient home medications include lisinopril, metoprolol, hydrochlorothiazide, hydralazine, Eliquis. So I'd like to include the medications because they're important. We're gonna resume these home medications, okay? And then you ask also specific questions for the chief complaint. Let's say if somebody came in with shortness of breath, you don't know if it's COPD exacerbation, you don't know if it's heart failure, you don't know if it's a pneumonia. So you ask the pneumonia questions, if there's any fever, cough, stuff like that. If there's any COPD, there's any patient history of smoking, have you been diagnosed with COPD in the past? For obstructive sleep apnea symptoms, same thing, like any fatigue, difficulty with concentration, all these things. And the heart failure presentation questions that you ask, only do you feel breathless at night? How many blocks can you walk without feeling short of breath? So this kind of things that it's really look good if you ask about them. This is going to make you a great physician, very competent. And then, so this is kind of the HPI. The other thing is exam. Try to make it as full as possible. Try to include as many details as possible. Now we get to my favorite part: assessment and plan. So this is the history and physical, H&P. Now the assessment and plan, a lot of people write like just plan what to do. That's not the best way. Like, what I think, in my opinion, is to write chief complaint. What are the problems that we are having today, and how are we dealing with it? Let's say, for example, chest pain. Next line, hyphen. We ordered cardiac enzymes and EKG, period. So initially, I would like you to put in the beginning, I would like that, what do you think is the diagnosis, what cause the problem, and then write a diagnosis, okay? Maybe chest pain due to a heart attack, okay, due to STEMI, okay? Or you can do it like this. So what do you think it could be causing that, and what's your differential in the beginning? Because in the beginning you may not know, you may not have all the answers. So you think, what could be causing that, and what are we doing? What are we doing? What are you treating it? What causes it? This, and the second thing is that what is the treatment that you're doing, and test, okay? Third thing is like follow-up plan, okay? Plan, okay? So let's say this is the problem, okay? Problem 1. So speak your thought process out loud. It's very important, okay? So this is kind of the things, okay? So we can just do, like, we can do a problem. Let's say we're going to do a problem. I'm going to do like example, okay? Dyspnea likely due to COPD exacerbation. Next line, hyphen. due to COPD exacerbation. Next line, hyphen. We think it's COPD exacerbation due to hyperinflated lung on chest x-ray and wheezing on exam, period. Next line, hyphen. We're treating with Doaneb, Brio, and Incruz, period. Next line, hyphen. We're going to do ABG if any worsening of respiratory status noticed, period. And then what you can do is also their baseline, what are their own, like the pertinent things, and what are your thought process. It's very important, like, to speak out your thought process in the exam. For example, a patient is on home oxygen, so you can add that to the assessment plan. This is a pretty good idea to add that too. The patient is on 2-liter oxygen at home, period. Next line, hyphen. We're gonna order echo, BNP, cardiac enzyme to rule out any cardiac causes for dyspnea, period. So this is kind of the things that you're looking for. So this is if the patient only presented with chest pain. In the ICU, there's something that is my favorite, is that doing it system-wise. And the way you do it system-wise, you go in Epic, you go through the summary tab, and then there are certain things that are very important tabs on Epic. Summary tab is the most important tab that I like. And then you can go to the comp, it's very important one. Micro, you can do the radiology, and then you can do intake, output. This is the most important tabs in Epic if you're using Epic. So ICU patients, or the one that are extremely complicated, they have multi-organ failure, the way I handle it is like this. Next paragraph, neurology, next line, altered mental status, hyphen, likely due to metabolic encephalopathy, period. We ordered B12, TSH, ammonia, and LFT panel, period. CT head is unremarkable, period. Next paragraph, cardiovascular, next line, anastemy, hyphen, we will trend troponin, period. The patient is on GDMT, including statin and aspirin, period. Cardiology following, period. Next line, HFrEF, hyphen. The patient is on lisinopril, metoprolol, period. Echo showed EF of 35%, period. So this is kind of an example, okay? So I'm going to continue the systems. Next paragraph, pulmonary, next line, pneumonia, hyphen, we think it's hospital acquired pneumonia, so we're treating with broad spectrum antibiotics, include vancomycin and zosyn, period. We ordered Legionella, strep pneumo, and sputum culture, period. Blood culture is pending as well, period. Next paragraph, renal, next line, AKI, hyphen, we think it's a pre-renal due to sepsis, period. We're treating with fluid support, normal saline, 100 cc an hour, period. We're gonna check urine electrolyte and osmolarity and renal ultrasound if no improvement in renal function noted, period. Next paragraph, GI, next line, GI bleed, hyphen, we will monitor CBC and consult GI, period. Protonics BID, period. EGD once stable, period. Next paragraph, So these are the important systems that I'd like: neurology, cardiovascular, pulmonary. These are the most important one. And then you go to renal, GI, and then you do infectious and hematology. Infectious, next line, HCAP, or you can say septic shock hyphen. Septic shock is improving as the pressure requirements are decreasing, period. We're going to continue broad spectrum antibiotics and follow culture results, period. Next paragraph, hematology / oncology, next line. Microcytic anemia, next line. Hyphen, we're checking iron studies and reticulocyte count, period. Will maintain hemoglobin more than 7, period. It could be due to the GI bleed, period. So this is kind of an example if you want a HMP, if you want to, for the ICU patients, because they have multi-organ failure. So you want to kind of address all organ. This is a really good way to help you be focused and not miss any single thing in ICU, and that's a very important thing, you know. So this is kind of a summary just to keep the video short. For a progress note, I usually go through these tabs. These are very important tabs. Every day I look at them for progress note. So I mentioned like I mentioned about the vital signs, what happened in the vital signs, what happened in the kidney renal function, what happened to the, even when you present, you kind of make a quick note when you present. You just say, okay, AKI is better. You can put the creatinine number. You can do COPD on less oxygen requirement. So it depends. Like every patient needs certain follow-up. Like if you ordered urine osmolality, you follow up on that. And then there's a really nice way in Epic is that to click notify me, so that it notify you if something comes up. Like oxygen, fluoride reading, and CT, alter mental status, MRI is negative. So writing the things that kind of progress on every chief complaint, even when you present, you say, okay, sepsis is better, off pressors, continue antibiotic, follow cultures, and COPD requiring less oxygen. We're going to continue to monitor, continue doing a brio, cut prednisone dose, stuff like that, you know. So this is kind of a summary of the HMP and progress note. I wanted to keep the video small so that next time we're going to do certain cases, and hopefully it'll be helpful. Thank you.